Older Americans are feeling the pinch of soaring cost for vital prescription.
According to the AARP, prices for top prescription drugs covered under Medicare Part D have nearly doubled since they first hit the market, and it's led some people to skip doses or not refill prescriptions at all.
Consumer reporter Carice Jackman examines why costs have skyrocketed and the solutions to help more patients afford their medication.
Cindy and Greg Mears know the importance of quality health care, not just as patients, but as lifelong professionals in the field. Greg as an emergency physician, Cindy in healthcare policy.
Healthcare's changed a lot, where it used to be you had a physician and a patient and there was a physician-patient relationship. And that physician was working with the patient to guide them through the process.
They've also experienced firsthand the burden of rising prescription costs.
I experienced that frequently.
But what we've also seen is that the pharmaceutical companies are now pricing not based on what the actual cost of development of that drug is. They're pricing it based on change of life, cost of years per life saved, or benefits.
The AARP has been monitoring the increase in drug costs for years, particularly under Medicare Part D.
Unfortunately, what we have been hearing about and why AARP has been so engaged on this issue is that there are people who are having to choose between the prescription drugs that they need and other important things like their food or their rent.
The AARP Spotlight Report found that list prices for 25 top Medicare Part D drugs, which currently aren't included in Medicare drug price negotiations, have increased by an average of 98%. These findings highlight why AARP's Lee Purvis feels the Inflation Reduction Act of 2022 is so important. It includes a provision designed to combat high prescription cost. The first provision allows Medicare to negotiate the prices of certain high-cost prescription drugs. 10 have already been selected, with more to be added each year.
Unfortunately, I have a lot of stories from people who have reached out to me because they've been struggling to afford their prescription drugs. And our position has always been that no one should have to make those types of decisions.
Purvis says once the law is implemented, the first negotiated prices will go into effect in 2026.
To learn more about the drugs on the list, head to investigatetv.com and search Medicare Part D.